How's it going, everybody? My name is Jesse and welcome back to Male Nurse Mentor. This is going to be the last segment of this Q&A that I'm doing. Probably won't do one for a while, but I did want to get into the workforce, or those newly graduated nurses going into your first job. Excuse me for my voice, it's a little bit raspy. I got some water right here, but we're gonna make it through. I still want to continue to make content for you guys at least once a week. So friends, it looks like I have a total of 14 questions. I'm gonna kind of go a rapid style with these because otherwise we're gonna be here forever, but I did want to touch on all 14 of these. So check out the timestamps down below. Maybe there's some you're more interested in than others, but save yourself some time if you want to, or just hang out the whole entire time. But I take no offense, it's okay. For this first question, friends, I have, what should new grads expect in their first 90 days as a nurse? I would say, so let's say you just got hired, right? It's your first 90 days at your first job. A lot of it's gonna be orientation, and make sure you lean into the orientation, right? It's an entire process, and it's probably gonna be the easiest part of being a nurse. There's gonna be parts that are intimidating because you're seeing new faces, you're new to the environment, you're new to the weight, right? That weight of, oh, I'm an RN, having the RN behind your last name, right? There's a weight to that responsibility now that maybe you're not used to, and it's a little daunting, and that's okay. But lean into the 90 days. Just kind of understand that this is your new phase here. You're now in the working phase of this journey here, and it's all going to be new. It's going to feel nice. You're going to get your paychecks. Everything's going to feel like fresh, right? And lean into that excitement, right? And with the nerves and the anxiousness, it's okay, it's gonna be there, but lean into the fact that right now it's actually a little bit easier, especially like the first week, first 2, 3, 4 weeks, maybe even into the shadowing phase, right? When you're shadowing other nurses. Lean into those things that make this part pretty easy, right? You're not someone just let loose on your own, like running the floors, right? With no one to watch over you yet. It's the first 90 days. So take all those emotions and just let them fall where they fall, right? Do some self-care for yourself in between, and you're gonna be okay. It can seem daunting, but lean into the good parts is what I would say. So for this next question, how can I make a good impression on my preceptor and team? And I know if you're getting hired into a good hospital, one that you're proud to be in, you always want to make a good impression, right? You're already thinking about your next steps, but slow down a little bit. When you're new, people don't expect much from you, and especially when you're new grad, right? So not only are you a new nurse to their facility, you're also a new grad in general. So the expectation of you is not going to be quite high. It maybe sounds bad to say that, but lean into that part as well, right? People don't expect much of you. Just come and show up with the basics, right? Be kind, be helpful, be curious. Have some internal goals with yourself so that way you get through your week, maybe get through your month, right? Maybe have some skills in mind you want to practice. Just be a good member of the team, right? And I know you know how to do this part. Don't put too much pressure on yourself to stand out. It's not necessary. You're very new, and a lot of people are very understanding of that. So for this next question, what's the difference between book knowledge and real world nursing? If you scroll back through some of my videos, I know there's a lot at this point. I think it was a short. One of my shorts, I actually explained this. There's a difference, and it's one of the things that I noticed kind of early on in my career. Let me get a sip of water. And hit the thumb up button. I'm gonna make it through this video. But it's one of the differences that I noticed kind of early in my career, or I guess later in the nursing school phase, right? I noticed that as I was doing clinicals, right, in school, a lot of the things that the floor preceptors were teaching me wasn't in the book, but it worked and it was effective, and it was in many moments necessary. As I became a new nurse on the floor on my own, I realized the same thing. And I started to just kind of not pull away from the book knowledge. Like, it's very important. You need the foundation. When you're in the field, you're not going to be able to do it by the book sometimes, or maybe even most of the time. But that doesn't mean that you're doing it wrong. It's just there is going to be a difference. The book knowledge, it's there to help you pass the NCLEX, period. Like, that's just the way I look at it. That's what nursing school's for. It's to give you a nice foundation, so when you go and practice on your own as a nurse on the floor, you have everything you need. But apart from that, it really is just to pass the NCLEX. Once you become a nurse, right, on your own, on the floor, at your first gig or throughout your career, you're still going to remember that book knowledge, right? And it's very important. You need that information. You need to know why it is that you're doing certain things. But when you're in the field, you're gonna, knowing that knowledge, do it in your way, right? Obviously there's safe practices for many things, so you don't want to deviate too much in certain things, but oftentimes in many things, you're going to see this, you're going to feel kind of weird by kind of cutting corners or doing this and that. There's going to be certain things that you're going to realize over time. It's for the book, and in the practical sense of working on the floor, you're just going to have to do it a different way because of time management, being realistic with certain situations, and maybe the acuity in the moment, right? Like there's certain things that you can only learn by touching it, being in it, experiencing it for yourself. So yes, there's a big difference between book knowledge and real world knowledge of the nursing profession. It's kind of hard to explain. Hopefully I did a good enough job to explain that. Excuse me for my voice, it's like dying a little bit. So for this next question, how do I manage feeling overwhelmed with patient loads? Unfortunately, it's going to be one of those things where you're going to feel like you're drowning, but the idea is through orientation, is you're going to be able to get to a place that maybe you're now comfortable to at least handle maybe 3/4 of the patient load, maybe half of the patient load, and then eventually the full patient load, right, throughout orientation. That's the idea. And then when you're actually out on your own on the floor, right, maybe you still have coworkers, maybe someone that checks on you, someone that you can go as a resource, right, if you get stuck or swamped, right? That's the idea. And typically that will be the case. And if it's not, and they're trying to push you to the floor when you're not ready, make sure you kind of vocalize that. You advocate for yourself. This is your job now. You don't want to start off on a shaky foundation. If you're not ready to fully be on your own, try to squeeze out another week or 2 weeks, maybe a few days, right, with your orientation or your preceptorship. Feel ready before you go on your own, and if you're not fully ready to be completely full patient load on your own, you just want to communicate that, because otherwise you're going to feel like you're drowning and you're not going to like your job. You're going to probably leave, right, and quit. So they don't want to see that. Management wants you to stay, so communicate that. That's my best advice. So for this next question, what's the best way to ask questions without feeling like a burden? This one's just a short, quick one. You just gotta ask. You just have to ask. Just lean on the fact that you're a new nurse to that facility, and ask, right? It doesn't matter what the question is. Pick the brains of the people there. If you have a question, no matter how dumb it may seem, when you're new, ask them. Because trust me, as you become a nurse for years, and then you ask that same question that felt dumb at the beginning, well, how are you gonna feel later now that you're a couple years in, right? You still now have to ask that question. So I say definitely just ask. You just kind of have to do that. And some of them are gonna feel dumb. They're gonna make you feel a certain way, but that's okay. Like, we can work through that part on our own, right? But still ask that question. And trust me, it's worth it, because you do have patience on the other end of knowing that answer or not. For this next question, how do I balance speed with accuracy when charting? I'm just gonna let you guys know you're gonna be a slow charter at the beginning if you're actually trying to do a good job. And this is, again, one of those things where it's like the ideal picture of a nurse versus real life nursing. If you try to chart the way that everyone tells you to chart, it's really not going to be possible. I mean, if you want to stay an hour and a half after your shift charting that way, that's a choice. But most people eventually realize you just chart what's necessary, and that's why you do get like limited charting notes sometimes. But eventually, when you kind of find your own footing, you're going to be able to do both, right? You're going to be able to chart the thing that's actually critical, crucial, the information that's necessary in that case, and you're going to kind of skip out on all the fluff, right? So it takes a while to really get good at charting. Eventually, you want to get to a place that's like a happy medium. You're not charting everything, but you're also not charting like 5 words. And sometimes there's gonna be moments where you chart 5 words on something. Other times you kind of know in your gut through experience. In this case, I gotta chart a little bit more. So it's a dance. You're new. It's okay to be slow. It's okay to not be good at charting. It will come through experience over time. For this next question, how do I build confidence in clinical skills I don't feel strong in yet? It really is just repetition, practice. That's it. Like, it's just doing it over and over again, practice, having different experiences with those skills, and yeah, just repetition and practice, really. Because if you don't do the skill, you're not going to get good at the skill. If you don't repeat it, don't have opportunities to do it, you're gonna feel kind of rusty. That's just kind of how that goes. How do I handle difficult coworkers or unsupportive environments? My advice for this one, and sure, you're gonna be new, you're gonna be a new grad, you're gonna experience some things from nurses that have been there a long time. Some people are grumpy. It's just anywhere you go, right? If you worked in fast food, you worked in retail, you worked anywhere, like, you're just gonna get all types of personalities. It's gonna be the same thing for nursing. Just because someone's a nurse, right, spent the time to become a nurse, it doesn't mean they're a great person. Like, you're gonna get grumpy nurses, you're gonna get mean nurses, you know, that's just gonna be how it goes. My best advice for that is just kind of stay in your lane, right? Stay in your lane. If something doesn't pertain to you specifically, it's radiating around you, right? All the drama stuff is around you. I would just carve out my lane, and typically that's what I would do. And I was just that person. I was really easy to get along with. People would come to me all the time for certain things and just to converse. But I like being the easygoing person. I'm at work. I don't want work to be any harder than it needs to be by adding a layer of drama and all these other things. I'm just here to, you know, help patients, but also just make my money and then just go home. And that was always my approach, and it worked out well for me. So that's what I would say. So for this next question, how can I find a mentor early in my career? You know, one of the best things I would recommend is the people around you in your vicinity, right? Maybe a preceptor during orientation, a coworker who's been there for a couple years longer than you have. That's kind of how you find people that you can gravitate to ask questions, to ask support, charge nurses. You know, that's how you do it. Otherwise, you got online, people like me. I know there's so many other nurses on YouTube who actually dive into a lot of the clinical stuff if you have clinical questions. I'm more of like a career, lifestyle, looking at nursing as one thing that you do type of mentor. That's my approach, you know, or career ladder. Like, that's my approach. But, you know, look in your vicinity, see who you can go to, who's reliable, who's easy to connect to, right? You see a lot of easygoing nurses in there all the time. People that give that energy, they make you want to come back and talk to them, right? And ask them questions. Like, you feel safe, right? And otherwise, online, you know, we're here as well. What should I do if I make a mistake? Always, if you make a mistake, it's not going to feel good. I've made plenty of mistakes in my career. I've had to do like med-error reporting. Like, I've been there. The best thing you could do is not brush it under the rug. It is not act like it didn't happen. It is to actually bring it up and show it, do the report, speak to management, let them know, tell on yourself. You know, that's the best thing you could do whenever, you know, you make a mistake, right? Especially with patients. You never want to be caught in something that was a mistake and you didn't report. It's just going to go way worse for you. So just own it. It's not going to feel good, but that's the one thing that you have to do. So for these next questions, these are a little bit more about long-term career mindset questions. How do I deal with burnout and compassion fatigue early on? My whole channel seems to be on this. I touch on it almost all the time, but if you still need an answer, I would love to give you one. The best thing you could do, friends, is align your life in a way that, like, it's a life you want to live, right? Nursing is just one thing. It is just one thing that you do. Period. That's it. There's people that go and, oh, you know, my life's calling is to be a nurse. Like, the one thing that I've always wanted to do is nursing. Okay, you've done it. Now what? Like, you have the rest of your life. You're at work 12 hours a day, 3 days a week, or 8 hours a day, 5 days a week. What are you doing with the rest of your time? That to me is living. That to me is life, right? I also come from the mindset of I work to live, not live to work. So it kind of starts at the root of looking at life that way. Right? Even if you hate your job, you're still getting paid well, right? You're still a nurse, you've accomplished something. What do you do on your free time? That's an easy way to put it, but I know sometimes it's not that simple. So when you start to feel burnout, when you start to feel like the nursing job just isn't aligning, you have to sit with yourself. You have to make some tough decisions, because nursing is so broad. It is probably the job that you're in at the moment, right? Or you're new and you have to get through the newness, right? The new pains of being a nurse, right? Or a new role, right? You have to get through that first. It takes about 6 to 8 months or so, a good solid year even sometimes. Once you shake that off, see if you're still not liking this role, this job. And if that's the case, you gotta move somewhere, because if you stay in that environment, you will eventually burn out. You will eventually have compassion fatigue. Like, you're eventually going to just dig a hole for yourself. The one thing that you can do for yourself, friends, is always look out for yourself. Don't allow yourself just to be a robot and just go through the motions of life, work, whatever it is. Create a life with intention. Nursing is just one tool to do that. Gives you a stable career. Hopefully you don't get laid off. I mean, the markets are weird nowadays, but you get a good source, a solid source of income. That to me is a tool that then I can use to go vacation, invest, buy the house, have the family, whatever it is that you want to do. Right? A good tool. That's what nursing is. And that, to me, is my response. The next question is, should I stay on my first unit for a year, or can I move sooner? It really depends on what your career goals are. I would say give it like 6 months at least, but sometimes some places are intolerable. and listen to your gut. If a place is intolerable, don't worry about what's going to be on the other side of what it looks like. Connect to yourself and see what it feels like for you, right? Because some places are so intolerable, they're suffocating. I got to get out. Me being here is like hurting me. It's like burning me out, right? It leads to all these things, right? It makes your life worse. If you're like that, don't bear it. Look around. You're going to realize that in looking, maybe that takes a little bit of the pressure off, but you also won't get a job like right away. So as you feel this intolerableness, right, you start looking, and the next job may be 8 weeks away, 4 weeks away, right? It will still be some time. And maybe by that time passing, now you have a little bit more time where you currently are. So I say at least aim for 6 months. If not, it's okay. You definitely don't have to stay for a year. My thing is, as long as you carve out your nursing career with intention, you're gonna be just fine. You just don't wanna continue to make the same mistake over and over again, right? Like if I never wanted to work in a hospital and I go work med surg, right? And I'm 6 months in, I'm looking to leave. And from there, I'm like, oh, I just gotta get out of here. And I go jump into another hospital floor. And then again, in 6 months, I'm like, oh, I'm back in the hospital. Like I really don't like this again, I'm realizing. Now I got to jump again. You don't want to keep jumping ship. If you create a career with intention, you will end up staying in places for years, and it'll be a lot easier to stay there, right? And then that is what looks good on your resume, right? You don't want to jump and continue to make the same mistake. That's why I say, in some ways, right, in some videos, are you a clinical nurse or are you a non-clinical nurse? Start there. It's okay if you're a non-clinical nurse. You're still a nurse, there are still plenty of places for you. And I really break it down like that. There's a lot of nurses that are so clinical, it's all they want to do, right? And that's okay. So just find out what it is for you. What's one thing you wish you knew as a new grad entering the workforce? I think for me, one thing I wish I knew was that nursing is just one thing that I do. It kind of ties back to that thing again. It's like you spend so much time trying to become an RN. It's not an easy endeavor, but you did it, right? You accomplished it. Now you're a new grad. What's next, right? Investing, make sure you invest within the first year, right, of being in the workforce. That's one thing I wish I knew and one thing I did towards the end. I'm here to tell you. Another thing is just, maybe when you're a year in, decide like, what is the next thing, right? Like just start looking ahead, right? Do you want to do management? Do you want to go back to school and become like an NP? Maybe there's a certain special floor you haven't really gotten into, you want to get to, right? Maybe you want to be a case manager. Maybe you want to be a non-clinical bedside floor nurse, right? You start to think of those things. Those are the things that I would try to push you to do, to think of, knowing what I know now. Just plant a little bit of those seeds and see what happens. Here we are, friends, at the very last question. My voice made it. How do I set myself up for leadership, specialization, or advanced practice later? My general advice for something like this is don't think of that next step until at least 1 year in, and if not 2 years, right? Between year 1, year 2, give yourself that time to think of what that actual next step is in advancement of career. Like if you want to go to management one day, maybe you've already been exposed to enough managers to kind of see which one you like, right? Or maybe you've been around enough like nurse practitioners or different floors and specialties that like you see which one you like, right? It takes like a good year, 2 years into the workforce. And the one thing I'll say with this is a lot of people are scared to then like pull the trigger on when to go back to school. A lot of people say, oh, I got to be a nurse for like 4 or 5 years before I go back to get my master's. And that's not true. You don't have to. I didn't listen to that, and I got to where I wanted to be a lot quicker, right? I was also, I think, the youngest in my master's program. But like, those are things you have to think of first. So if you're not even thinking of it, you're not going to follow through with action. So for me, I just like planting those seeds. 1 year, 2 years. At 2 years, you should for sure have thought about what is your next step. Even if you want to be a floor nurse for your whole career, do it with intention. No, I like this. I'm going to choose to be here, right? Don't just be a floor nurse because you didn't think of anything else, right? That's my viewpoint, which a lot of nurses do. No, do it with intention. Everything with intention. That's my general advice. And that's going to be it, friends. Thank you for bearing with me in my voice. Like I was losing it in moments, so I do apologize. I hope this video was helpful, friends, and I will see you guys in the next one, as always.